The director at the ORI Group Abel Manyike as well as the director of Blackhead Consulting, Edwin Sodi, will testify. ORI is a company which performed the audit and assessment of asbestos roofing in low-cost houses in the Free State. Let's go there now live.
So I got the impression that part of the assessment is to see which houses must government give priority, because already people who live in that house are in danger. They could be injured. And he said, and it's not just in the roof. I think it's elsewhere as well in the house. That was my understanding. If that is my understanding, and if that is what he said, does it accord with your understanding of assessment?
No, it doesn't.
It doesn't.
No,
your understanding of assessment doesn't make it necessary that you should go into the house. Is that right?
No, we don't have to. Yes, that's correct, Chair.
Doesn't, yeah.
We don't go inside the house.
Whatever you want to see, you can see from outside the house.
Yes, we don't test the asbestos. We identify it.
So what are the potential things you look for standing outside the house when you are assessing, on your understanding?
We train people on how to identify asbestos. From outside, first of all, you look at the shape and the color.
Oh, is that the roof?
The roof well? Outside.
The roof, yeah.
Yeah, even if it's if you can't see the color, if it's painted, you look at the shape. So we train our people.
Yeah.
What to look at, and mostly on houses with asbestos, you'll find they won't put in gutters and so forth. So these are the things that people look at, and we even encourage them to say, if you can, go inside the yard, look underneath. And then
that is now inside the house.
Yes, Chair. And
so sometimes you can do it without going into the house. Sometimes you have to go into the house.
Yes.
Okay.
And to my amazement, I would say 95% of people that we trained, they knew what was asbestos.
Yes, but let me just go back on the assessment part. Is it simply to see whether this house has got asbestos, on your understanding of assessment? So when you send your field worker or somebody there, is it to look for indications whether there is asbestos?
Yeah, the audit part is the asbestos.
Yeah, that's the audit part.
The assessment part is the structural integrity of the house. We put other questionnaires there for us to have an indication as to what is happening. But the bulk of the works was done by the program. Things like your georeferencing and so forth.
Yeah.
So I would say maybe on per assessment, 40% was done by the field worker. To say when you get to a house, look for these things when you assess the structural integrity of a house.
Yeah.
Look at the crest must be certain width, and then you record it like this. Is the house plastered, which is very, very an issue, if the house is plastered or not.
What is the situation, what is the impact of a house that is plastered on your assessment? Does it mean it's difficult to assess, or is it easy, or?
No, it's going to inform the bill of quantities. The bill of quantities will inform the budget.
Yeah.
All right. What is happening now in Mamelodi, I think the past 2 years, when they were removing these houses, also I saw some were being removed in Soshanguve. If the house is not is plastered and it had asbestos, when you remove the asbestos, the wooden posts must also go away. You find some of them they're no longer in a good condition. So you put this steel, and then on top you'll have to plaster. You'll have to fix. So it's important that we mention these things. Whether there's a geyser on the roof, it adds to the cost. Someone must remove that geyser and put it back. So these are some of the things.
When you talk about remove the geyser, you're not talking about the person who is coming to make the assessment.
No,
you talk about later.
No, the person who's making the assessment, we made that allowance, that record if there's a geyser.
Yeah.
Because we know later on, when should the department appoint whoever to come and
To eradicate.
fix these houses, that thing will be an issue.
Okay.
To say, well, there was a geyser here.
And it adds to the cost.
Yes, it adds to the cost.
Yes. But just to go back, you said the assessment relates to the, I think, did you say physical integrity of the house?
Yes.
Yes. I understand that to mean whether the house looks like it might collapse anytime or in due course. Is that what it means?
Yes.
Physical integrity of the house.
Yes.
When you, for purposes of an assessment done in the context of this project,
Yes.
does it matter whether the cause for the house to be like that, namely, it looks like it might collapse any time or it might collapse in 6 months' time, does it matter whether that might have been caused by asbestos, or it doesn't matter what has caused that condition to happen for purposes of the assessment? So in other words, are you only looking for what damage the asbestos has done to the physical integrity of the house, or are you just looking at the physical integrity of the house irrespective of what it has caused it?
There's a number of things which can cause structural problems. One of them could be the foundation also. But on this project, it was agreed that we won't be doing geotechnical studies. A visual inspection will be sufficient. I want to come there, Chair, just to show you that asbestos here is not the thing. It was about the structural integrity. And there have been comments about what people could have been appointed. The councillors could have chosen so and so and say, go and count these houses. And
well, I must confess that thought came to my mind.
yes,
But it may be ignorance to
yes.
say.
No, it's not ignorance.
Why
councillor.
can't you just get councillors who are paid to look after the
Yes,
interests of the community too?
It's not ignorance, Chair.
Yes.
That's what I'm saying. Some of us, when we come on these platforms, we fail. From our respective fields, we somehow we need to inform. To count and to audit are two different things. We know of projects in Gauteng whereby they were community-led. People were asked to go and count the potholes, to go and measure them physically, but they did that in the houses. We see these things. So to give a task like this to the locals without training, without georeferencing, without all these equipments,
It would not work.
it would have been done in 1994, but it wasn't. Because this is an exercise that needs people that are competent
to
do
not
it.
be trained to
Yes.
do it. Yeah. But am I correct then to understand that what you are saying is that the assessment part of the job requires a contractor such as yourself to have somebody who goes to the house but does not need to enter the house, but must see the house, and in seeing the house must look at what the state or the condition of the physical integrity of the house is.
Yes.
And then make a note.
All right, we'll have to leave the State Capture Commission. I want to take you now to Emadadeni in Newcastle, KwaZulu-Natal. Dr. William Keys is wrapping up his 2-day oversight visit to the province ahead of the peak, one would say, of COVID-19 cases in that province. Let's go there now live.
We just came to inspect the province of KwaZulu-Natal's readiness on the preparation for the surge, which we are expecting that as it started, is going to be increasing in KwaZulu-Natal. Yesterday, we focused on the areas which are around the cities, and we believe therefore that it was important for us to also have a sense of what the rural areas are. So we came to a district with a bit more of the rural areas, just to be able to try and balance the issues and the concerns that we need to be giving attention to. I think the starting point is the approach that the MEC has spoken about. We're following this approach the whole country. That is, the first priority is to take some of the facilities where we needed some facilities to be erected, where we could do so quickly. We take advantage of the time so that they are available not only for COVID-19 but also for the future. And then we go for some of the facilities where the buildings were existing but were not used or they needed to be repaired. And we've done that in a number of provinces where you find that the buildings were dilapidated or neglected and they've been repurposed and therefore being used again. And then in other areas we take existing buildings and we change the use of those buildings. And this is the case here where you've got a nursing home which is now being converted into a kind of field hospital, and it's going to give us over 44 beds. And then the whole province, the whole region, we've counted that it was going to give us very close to 300 beds, which I think for a start is a good start to look at. And what I've been happy with is the fact that there's been a very quick processes of tendering and completion, and all the refurbishments have taken place within a reasonably short period of time. It doesn't quite work like this in normal life, but I'm happy to see that we've actually taken a new speed of getting things to be done. And so I hope that we can actually maintain that kind of speed. Of course, I know a lot of it has got to do with the disaster regulations which allow us to shorten processes. So having been around in this region, I'm quite comfortable that there is adequate provision for the beds which we will need should the surge materialize in higher numbers. And in this case, we believe therefore that there will be enough warning if the numbers are increasing that we can actually roll out some other additional facilities. We've been through to this Madadeni, which is one of the larger regional hospitals, and we've got reports about Newcastle. We've been to the Utrecht area, Mazangeni, and here again we've seen how an old hospital has been refurbished, and there, because it's a bit isolated, we've made sure that there must be a phased release of the completed wards so that early occupation is possible. And I've seen that the staff is quite motivated and looking forward to it. So I think all in all, I would say we are expecting that the numbers will increase in KwaZulu-Natal, and I'm going to be focusing quite strongly into the province just to make sure that any challenges can be acted upon. What we have learned in the past few months is that there's no such a thing as a plan that's perfect. You go in, put up a plan, and then when the epidemic hits, it changes your plans, and you must be agile to change things and make sure that things are changed, and you respond as soon as possible. One of the lessons we've also learned is the need for early introduction of oxygen, and which we have now been putting up in a lot of the areas. And even here, I was just talking about this area to say, even though there was not an anticipation that there will be very sick patients, we do need to have extra availability of oxygen so that if there is any pressure, you can stabilize patients even before you go to the rest of the other area. The ones I just seen, I'm going to leave with the team, is to also make sure that they replicate the issue of Beds Bureau, which is an administrative center that looks after the availability of hospitals so that it becomes an administrative issue as to where there are shortages of beds and where the hospitals are full. But then the people who carry the patients can call and know that they need to move their patient to this particular place. This is particularly important for us because we've been making a call that particularly in this province, people must know that, there's no such a flu these days. You go and check, and first if you find that you have symptoms that are suggestive of COVID-19, we must do a test, and then we must see how we manage that situation. We have also been talking to the National Health Laboratory Services, and as I said, they should by today have cleared the backlog so that there's a much shorter turnaround time that allows for an early diagnosis. So if someone has got symptoms, flu-like symptoms, we must be able to quickly decide whether they need to be treated in a COVID-positive area or not. And so we've got enough beds here for patients under investigation, which means that those beds must not be clogged by people who are waiting for the results. They must be moved quickly to the area where the proper treatment will be started. And that is the efficiency of the system, the way the system must work. And we are comfortable here as well that there's good understanding both at the provincial and at the district level of the pressure that's coming and the need to respond swiftly to those kinds of situations, and also to make sure that there's good information to the community. The other aspect that we've had to focus on, we are meeting with the Provincial House of Traditional Leaders, and the reason why we do so is because we have noticed now, since there were reports about excess deaths, we are concerned that the further away people are from large centers, large hospitals, they will tend to be reluctant to move quickly if they think they've got mild flu symptoms, and yet these can be devastating to those who are senior citizens and those who have got comorbidities. It therefore becomes important to send a message to all the traditional leaders that communities must not undermine a simple flu and say it's just a simple influenza, because this time around we've got a problematic COVID-19 problem condition which needs to be treated early, and so we can save many more lives if people understand that, and therefore they seek assistance early. And we are saying so knowing that we've got adequate space to be able to accommodate those who need to be accommodated. And of course, we also want to encourage people who have got other conditions, diabetes, blood pressures, or hypertension, cancers, and other ailments. They must continue to use our hospitals. When we say that we want to give attention to COVID-19, we're not saying that we're not treating other diseases. They're just as important as any other. So it's important for people to know that we want to avoid anything that would cause morbidity or even loss of life, and therefore hospitals are meant for that. So it must not ever sound like we're saying only COVID-19 is what we treat. We're treating everything, and we'd like people to continue to use our hospitals. They must not fear to visit our hospitals because of COVID-19. We've also made sure that the approach to the hospitals for anybody, there must be what we call a separation point, which is a triage area. This is where we basically check the symptoms of anyone walking in and make sure that those who have got symptoms that are suggestive of COVID-19 should be separated and be tested, and those who don't have symptoms must actually move to other areas. We try and keep the hospitals streams that separate so that we actually avoid the mixing of patients. That's partly why we are not seeing a very huge mortality. We learned this from China, that the first wave of infection that happened in Wuhan caused a lot of deaths, mainly because of the mixing. But once they taught us that we need to watch out for the mixing of the patients, and it became important for us to adopt that for every hospital. So that is now a practice that we are utilizing. So once again, I want to reiterate that we did say that we wanted to defer the surge, the peak, so that we can prepare our health facilities, and this has happened. You will all notice that we are actually not at this point overloaded or overcrowded. We're managing the patients, and we can take more patients even if the surge increases. And we have actually stuck to all the commitments that we had made in terms of where we're going to put hospital beds, where we're going to refurbish hospitals. We are all on course and on track, and partly that's why one has to come around and inspect these particular areas. Some of the areas you get a little bit of excitement. I was looking at the tweets by the Honorable Kwahube, who made a story that she went to look for a hospital and she didn't find it, and that she was told that there was going to be a hospital in Rustenburg. And of course, I looked at the question and the answer. The answer she was given, which we submitted to Parliament, was saying that there must have a hospital with 200 beds in Rustenburg, and I can confirm that such a hospital is in operation. It was opened by Premier Job Mkhoro, and it's already operational. It's a private-public arrangement, and that's all that was in the answer. Now, now that there's a whole speculation, the hospital is not there. There's a photo taken. So I was having a chat with her as I was coming over. Clearly, she misunderstood things, and the reality is that she went to look for a hospital on a matter that I never raised in my answer. And I was explaining to her that when we ask questions, we respond very seriously in Parliament, because a wrong answer is misleading Parliament. So we take them very seriously. We've checked, I've spoken to the MEC. All of this basically means that the answer remains correct. There are many other plans of other hospitals that we're planning, so many other beds in other places. We didn't talk all about that. And I was explaining again to Honorable Kwahube that the other plans were not part of the response that she was talking about. And so she needs to correct that. So I expect her to actually acknowledge and correct that in public, because it's a wrong impression that's been created. However, between myself and her, I have understood that she really misunderstood it. It sounds like quite a very honest mistake, because in this case, she went to a site, but nobody has spoken about the site, and then she spoke to people there, and then she thought that, well, there was something that should have happened, which it didn't happen, and she has now been able to realize it. And so I'm hoping that she's going to correct it, so that the public does not remain with an impression that we misled Parliament, because we didn't. But the point I'm making, though, is that we've tried to honor as much of the obligations that we've put out in public. We've also made sure that we prepare the country to face up to the surge, and I can tell now that every country has had its own challenges, and so we wouldn't have expected that South Africans would not face similar challenges. But at this point, I think we have been able to use use the period on the lockdown to prepare the services. Yes, there are pre-existing challenges in the hospitals, so you'll find that the hospitals, before there were reports of people who were lying on the floor, there were people who were having bad food, there are people who had a terrible attitude from staff and so on. We're working on that. We're working on all of these issues because they are part of what we need to correct to improve the quality of healthcare. We did indicate last year that the main focus for us is a quality improvement program, which means that we have to increase the numbers of staff. We have also to train the staff members so that their quality of care is improved, but also we have to refurbish our facilities, and that we've also got to look at certain things, the softer side of issues, kind attitude, a smile, a comforting word from the nurse, and so on. And so we still expect that during the times of COVID, and we expect that even though we know that our staff are working under pressure, that we still appreciate the work that they are doing. And so in this case, we'll still continue to call upon our staff to continue doing the work that they are doing, and also to say to them, they must speak out. When there are conditions which are unsatisfactory, they must speak out, they must inform us. Where there is inadequate protection, they must speak out, and we've always keep saying that like soldiers in a battle, soldiers need to go to a battle well trained, well prepared, well protected, ready to face the adversaries. In this case, I've still not come across health workers who say they are fearful of COVID, but when they sit together, they do indicate where they've got shortages, where they've got challenges and concerns, and we must address those. And so we have also sent a message to our administration that where management is shown to be lax, we'll take strong action. And that's why we have George Mukari sent a team led by Professor Taulem Kwena to go and investigate. We're going to be sending others to other places. In fact, we're going to be sending another team to go to Pelonomi to go and look at what we received as reports. Some of the reports come to us as anonymous whistleblower reports. Some of us come from union members. Some of them come from staff and community. We pick those up and we therefore try and act. I think we must say that at this point we're still expecting that we will have another 2 to 3 weeks of a very high level of positive cases, and but we are really looking beyond that point. We are saying the fact that we are seeing the numbers decreasing, it should not be taken for granted. We must emphasize on the need for containment measures, distancing, use of masks, hand washing, sanitizers, cough etiquettes, and all of these become very, very important as a new way of how we're going to survive as South Africans.